Hello, my name is Armando Navarro, and my work is titled Mitigating Human Health Risk from Low Dose Radiation Exposure, Residential and Public Buildings. This is for West Texas A&M University, ENGR 6391, 70 Research Methods in Engineering, and we're gonna start now. So, first of all, I wanna outline the information that we're gonna review on this project. We consider on my slides. The main idea is that some radiation risk can be hidden, undocumented, and difficult for occupants to recognize, as people cannot see, smell, or feel gamma radiation. So, a reliable way to understand the problem is through records, measurements, surveying, and verification. And this topic connects, and this is a very important part that it connects cancer prevention research, because the concern is that the radiation exposure over time, it's also as important as having direct symptoms due to direct contact with radiation. And the background is, the question we can do is why hidden radiation in buildings. Uh, it's a public health and construction issue, which is totally documented for past events. So the audience we expect is for engineering and health people, students, for in order to make this information valuable for them, in order to for help people to the cancer research, and for construction people to be able to identify where a source, maybe an architectural selection or material selection, a radioactive or any or other hazard source, can be implemented on a building. So we know there's already procedures for OSHA in the United States, but we will explain that as follows in detail. So the case motivation is like, this thing is real and is documented, like I said, and we're gonna use a methodology for identification of possible hazards with record surveying, calculation, testing, and we're gonna do cost review as well. And we're gonna present some data, equation, and anticipated results and conclusions. So a background of this study is, first of all, the motivation is that radiation can be present without giving any warning to the people inside the building. And as most of buildings only have a normal called not dangerous background radiation, and that's not the problem we are focused on. We're gonna focus on localized radioactive sources. So a person can live or work near radiation source without seeing, smelling, or feeling it. Most buildings have normal background radiation, but unusual sources may remain hidden. Uh, this is the concern is not all radiation. The concern is avoidable dose of low occupancy. In a long term, dose reduction support cancer risk prevention research by reducing accumulated exposure. And we need to present a construction solution that can be measurable before and after the work is done. Like, if we're gonna encapsulate the radiation, or if we're gonna evaluate it before do that, even if the dose rate is low as measured, the total exposure can increase with the occupancy time is high. So you might not get the problem visually in months, but you can feel it in years, as gamma rays are very powerful in order to affect your body. So the key problem is the hidden source, low occupancy, and limited records that already work. So this is a part where our research can work. Other research in the future, and we're gonna expect better results in order to present something technical for this case. And we're gonna try to see that combination can create preventable exposure risk if nobody measures it. We're gonna measure, and we're gonna propose a solution as well. So the audience expect for engineering help people. We can present for them to that a low dose radiation mitigating building should be handled and measured for engineering purposes, not as a visual or fear based decision, like specifically on demolition or living with the fear. We can present solutions in order to for that. So for engineering research, We need to present a clear workflow, identify, measure, classify, shield, and verify, which shield will be our main concern of this topic. So building owners need practical solutions if we find radioactive sources that can affect in the long term before assume full demolition. And for the public and safety health, they need to connect this case and this research to cancer risk prevention area. So my goal for this is lead the audience to one point. Targeted shielding, it's only credible when it's based on data. That data is where we're gonna work for this, and it's gonna be a thorough job in order to present the quality of results that this project and this case that is pretty serious because it's involved health of the people, and it requires. So a question is here: how can a building be made safer without guessing or only saying, "Okay, we need to demolish"? So we're gonna present solutions. So right now, the asbestos laden mold hazard control logic is part of the construction because there's a lot of buildings in the 1960s that 96 and 97s in that were built without a. In that point of time, the research on the cancer risk on buildings was not as advanced as it is now. So we're gonna present something that we can rely on as the asbestos laden mold and hazard control logic OSHA procedures now with the radiation specific. So we're gonna do something uh, close to the asbestos, but with something different is what we're gonna try to test as for separate exposure from contamination uh, without disturbing until the good people, the trained people is involved in this. So we're gonna base on gamma rays for this one, as gamma rays are the one that uh, can penetrate in the organs and the skin of people. Alpha particles and beta particles are also dangerous, but when the contact is more direct. So the gamma rays presented on the cobalt 60, which is the main radioactive source that we're gonna present. It's the main topic of research for this study, as the gamma rays will be our main topic in study. So the exposure of this in long time, it's especially the case we're gonna study as when radiation energy reaches a person. This is where the cells can be modified. So this slide shows a difference that the person not necessarily be to radioactive close. We can present different solutions on that. And this article I recommend to the viewers to go study on that because it's a big one issue that affects a big portion of the country of Mexico. So cobalt 60 incident, they call it the Mexican Chernobyl. This is important for this study as the source can become part of construction materials, and once embedded, the removal may require relocation, demolition, and control waste handling. So there's countries where the OSHA safety procedures for foundries and the recycling is not as good, so they basically melt every steel that they come in without investigating. So there's part where there's no quality control, and this is very dangerous because as the cobalt 60 incident, that can escalate to big problem. So the objective of this is that develop a practical engineering approach to identify and reduce accidental dose ionizing radiation exposure in residential public building. We're gonna study on that the ionizing radiation exposure, and we are presenting the research workflow. So we're gonna do a risk classification. So this is where the 1.4 color chart is we're gonna focus on the deepest blues colors is our values that are of interest. So there's already a study for the X-ray rooms and some medical construction. The lead line, gypsum, and sheet are already the performance benchmark. We're gonna be very useful for this work. And they already do this type of construction, so this benchmark will be very useful for our project. So we are presenting a formula for the gamma rays, which is very important also for the research because we are now seeing only an illustrative uh, example, but we're gonna study this in depth. We're gonna use numerical data real for this. We're gonna our anticipated results. Is that at this stage we are not doing experimental. We only present our method and what we expect. And the conclusion is that radiation in buildings can be invisible in long term, but we're gonna, like I said, we're gonna study in depth. We're gonna do some testing with the authorized personnel in the OSHA safety requirements, and this is a very deep topic that we're gonna study. And I hopefully I can be good on the requirements for this work. And thank you so much. This was my presentation, and I appreciate it. And thank you so much to all the viewers. And like I said, we're gonna study this in depth. And any question, just let me know. Thank you.